Hello, everyone. My name is Carlos Filpo, and today I will be presenting my project on infection prevention strategies. This project aligns with the BSN handbook requirements, and all of the work you see was conducted by myself as part of my final practicum. This second slide is the certificate of original authorship, which states that I have cited all outside informations, and this PowerPoint is in APA format. This project aims to enhance infection prevention in a healthcare setting, mainly focusing on reducing healthcare associated infections or HAIs. The goal was to design and implement a training program specifically for nursing staff. This involved creating a curriculum, gathering baseline data, and later evaluating the effectiveness of the program post training. To implement the training, I conducted interactive sessions that included hands-on practice and role-playing exercises. This approach allows staff to actively engage, ask questions, and provide feedback. Overall, 25 nurses attended the training sessions, ensuring a comprehensive reach across the unit. The main goal of this project was to improve infection control practices on the unit. For Objective 1, we aim to increase hand hygiene compliance by at least 15%, with a baseline compliance rate starting at 75%. Achieving this will be crucial in lowering infection transmission risk. Objective 2 was focused on improving PPE usage accuracy by 20%, ensuring all staff use PPE correctly and consistently. Objective 3 aimed at reducing HAIs by integrating best practices in infection prevention, informed by recent research and literature. Combined, these objectives supported our overall reaching a goal of improving infection control in the unit. To meet these objectives, I used multiple strategies. The first was conducting a thorough literature review and analyzing current policies to understand the best practices and identify areas where we could improve. Evidence includes the review summary and policy analysis document. The second strategy was developing a targeted infection prevention training program using insights from both the literature and feedback from staff. The third strategy involved implementing the training and gathering feedback from participants to make refinements as needed. Evidence for this step includes attendance logs and feedback summaries. The fourth strategy was collecting data before and after training on compliance with hand hygiene and PPE protocols to measure the program's impact. The key training content focused on reinforcing thorough hand hygiene and correct PPE usage. We highlighted the importance of each step to ensure proper protection against infections, ultimately aiming to reduce healthcare associated infections in the facility. To measure compliance, we use pre and post training audits alongside observation checklists. By tracking adherence to hand hygiene and PPE protocols before and after training, we noted a 15% increase in hand hygiene compliance and a 25% reduction in PPE errors, indicating the program's success. This project has applications across multiple areas. In practice, it strengthens safety standards on the unit and reduces infection risk. From an educational standpoint, it emphasizes the need for regular hands-on infection prevention training. In terms of informatics, it highlights the value of using data collection and analysis to assess program effectiveness. This project was a significant step in my professional development. I gained practical skills in infection control, honed my leadership by implementing a program, and strengthened my commitment to evidence-based practice, which I plan to carry forward in my nursing career. Several challenges came up during the project. First, maintaining staff engagement was essential but challenging, especially with different comfort levels around infection prevention practices. Second, scheduling training sessions without disrupting daily workflow required careful planning. Additionally, there were resource limitations, particularly regarding PPE availability, which we needed to address to ensure effective practice sessions. The pre and post training audits provided a clear picture of the program's impact. Hand hygiene compliance improved from 75% to 90%, while PPE compliance rose from 70% to 88%. These increases show that the training effectively addressed the identified compliance gaps, particularly in key areas that directly reduce infection risk. After the training, I gathered feedback from nursing staff. Many participants expressed increased confidence in their infection prevention skills, especially with the hands-on approach. However, some requested more frequent refresher sessions to keep their skills sharp and express interest in case-based scenarios to make the training more relatable. Based on the project outcomes, my recommendations for sustaining these improvements include implementing refresher training sessions every 6 months to maintain compliance. I also recommend ongoing compliance audits to ensure the infection prevention practices are upheld. Lastly, securing additional resources such as PPE to practice can further support staff engagement and effectiveness in training.